With an aging population and insufficient healthcare providers, EMS must expand beyond emergency care. Many countries have already done this, and the US is exploring this capacity, especially through community paramedicine. There are 7 natural body openings, or orifices, providing access to an internal cavity through a natural passage called a canal, duct, or meatus. So from the top of the body down, external auditory canal directs sound to the brain. Nares filters and warms air entering the lungs. Nasal meaty leads to sinus cavities, which warm air and collect inhaled particles. Mouth entry to gastrointestinal and respiratory systems. Urethral meatus transports urine from the bladder. Anus expels solid waste. Vagina connects to the uterus. Sphincters control the flow through body openings, from tiny capillary sphincters to large ones like the anus. Healthcare providers can apply temporary interventions following normal anatomic pathways. Some of those interventions include nasogastric and orogastric tubes. Used for stomach access, these tubes require careful placement to avoid aspiration risks. Tracheal intubation through the nose or mouth is a paramedic procedure to ventilate a patient. Urinary catheters, flexible tubes for urine drainage. The Foley catheter includes a balloon to stay in place but can cause infections. Rectal tubes are inserted to relieve constipation or deliver medication. These tubes may have a balloon to anchor them. Non-anatomical interventions break through the skin to insert a tube or create a surgical opening to access an internal cavity. Ostomy is a surgical opening that allows waste removal through the abdominal wall. Proper bag placement over the stoma is crucial to keep the flow contained and prevent skin damage. Colostomy, temporary or permanent opening from the colon. Ileostomy diverts waste from the small intestine. Bladder diversions. Ureters are redirected to the abdominal wall or through a bowel conduit. Where a tube is involved, security is the key to decreasing the movement that may result in discomfort or dislodgement. Tracheostomy provides lung access when the larynx is removed or dysfunctional. Cricothyroidotomy, emergency airway access. PEG tubes, long-term feeding tubes inserted into the stomach. Suprapubic catheters, long-term urinary catheters bypassing the urethra to reduce infection.